The new coronavirus is similar to SARS, but with two important differences. First, the new virus is more infectious than SARS. Therefore, it's harder to stop it from spreading. Second, the new virus is much less dangerous than SARS. About 10% of those who caught SARS died. With a new virus, outside of Hubei province, the mortality rate is so far only 0.2%. In comparison, seasonal influenza has a death rate of 0.1%. So in terms of mortality, the new virus is much closer to influenza than SARS. But the situation is still evolving. Every day brings new developments, and we have to respond promptly and dynamically. So far, most of our cases have either been imported from China or can be traced to imported cases. When we discover them, we've isolated the patients, done contact tracing, and quarantined their close contacts. This has contained the spread and helped stamp out several local clusters. But in the last few days, we've seen some cases which cannot be traced to the source of infection. These worried us because it showed that the virus is probably already circulating in our own population. And this is why we raised the DORSCON to orange yesterday and are stepping up measures. We are reducing mingling in schools. We are tightening up access to our hospitals. We are taking extra precautions at large public events. I have already postponed my Chinese New Year Istana Garden party for grassroots leaders, which was to be held tomorrow. We have raised DORSCON to orange before. You may not even remember, but this was in 2009 for the H1N1 swine flu. So there's no reason to panic. We're not locking down the city or confining everybody to stay at home. We have ample supplies. There's no need to stock up with instant noodles or tin food or toilet paper, as some people did yesterday. Whatever the situation, we can each do our part. 1. Observe personal hygiene. Wash your hands often. Avoid touching your eyes or face unnecessarily. 2. Take your own temperature twice daily. And 3. If you're not well, please avoid crowded places and see a doctor immediately. These simple steps don't take much effort, but if we all do them, they will go a long way towards containing the spread of the virus. Right now, we are continuing to do contact tracing and to quarantine close contacts. But I expect to see more cases with no known contacts in the coming days. If the numbers keep growing, at some point, we will have to reconsider our strategy. If the virus is widespread, it's futile to try to trace every contact. If we still hospitalize and isolate every suspect case, our hospitals will be overwhelmed. At that point, provided the fatality rate stays low, like flu, we should shift our approach. Encourage those who only have mild symptoms to see their family GP and rest at home instead of going to the hospital. And let hospitals and healthcare workers focus on the most vulnerable patients, the elderly, young children, and those with medical complications. We are not at that point yet. It may or may not happen, but we are thinking ahead and anticipating the next few steps. And I'm sharing these possibilities with you so that we are all mentally prepared for what may come. I am confident of the medical outcome of this outbreak. Most Singaporeans should remain well, and of those who get ill, most should expect to recover. Among those who have been hospitalized, so far, most are stable or improving. Several have already recovered and been discharged, although a few remain in critical condition.